Alright, what this exercise is it's called an MWM, and it's what that means is immobilization with movement. These sorts of techniques, manual techniques, have been gaining very good evidence in the recent literature in the past five years or so. And this one specifically is very good for pain relief with osteoarthritis of the knee. So what it is it's a glide of the tibia underneath the femur, so your shin bone underneath your thigh bone. And you apply the glide as you move through flexion and extension of the knee. So what I'll get Elizabeth here to do it. What you do is you either apply a lateral glide, which would be pushing the tibia outside. So you have one hand on the femur just above the knee, one hand on the tibia just below the knee, and you simply push the tibia out. So you're pushing this way with your bottom hand. And then you simply just go through knee flexion as far as you can and back up, and then you release the glide. It's important that you hold the glide the whole way through the movement. So I'll just get Elizabeth here to show. And obviously the knee on the bed is whichever knee is affected. Good. So she's pushing the tibia out. Come back up. Good. She's pushing her palm. With her palm, she's pushing the tibia out. Good, and back up. Now, there's a few different glides you can do, and this is, you use whichever glide you feel the most relief with, okay? So there's the lateral glide, which is the simple push outwards. There's a lateral glide with external rotation or outward rotation. And in that case, what you want to do is as you push the tibia out, you rotate it a little bit. So there's a bony part just on the shin bone, just below the knee. There's a nice bony prominence. You can hook your fingers on the outside of that prominence, and you can rotate outwards. So rotate that way. Okay, go ahead. So she rotates, good. Holds the glide the whole way through, come back up, and then releases. And then again, good, and come up, and then releases. Now, the other one is a lateral glide with internal rotation, okay? So for this one, you're going to have to hook the bottom hand slightly more on the front of the knee so that you can rotate it inwards, okay? But you're still applying that outward force. Go ahead. Good. So she's twisting her hand inwards to twist the shin with it. Good. Keep going a little bit. Good. Yep. And up. Good. Good. And the last one is just a simple medial glide of the tibia. So it's the opposite of the first one we did. So she's going to be having her hands sort of opposite to what they were. So she's going to be pushing her femur out and her tibia in. Good. Good. And up. Good. So these are, this exercise isn't meant for strength or anything. It's meant for pain relief with arthritis, and it's been shown sets of 8 usually do the job, 8 to 10, and this is something you can do all day. You can't do it too much.